I am so honored to be recognized by the Society for Women's Health Research with the Women's Health Visionary Award. I believe that the promise of fundamental science in medicine is that tomorrow's patient will be treated better than today's. And my lab and I worked on that premise, leading to some of the breakthroughs that are being recognized tonight. As I look back on the research and the new field of medicine, oncofertility, I have distilled three things that seem appropriate for this moment. First, I never learn anything talking to myself. This is abundantly clear in lab meeting when the most junior of scientists knows more than you do when they stand to present their new results. Dialogue, debate over data, deliberation on next steps are keys to progress and can only happen when you move from a position of knowing to a position of learning. I'm a lifelong learner and have loved every minute of work with my lab members, all of whom are greatly accomplished and lifelong friends. Second, over the doorway of the Accademia di Chimica, Academy of the Experiment in Italy, is the inscription Provando e riprovando, test and test again. It is easy to think that you know the answer, even when writing a grant or doing the first experiment. Science needs intellectual honesty and testing and more testing. Oncofertility is the work that my lab and clinical colleagues spearheaded. We trialed, tested, and asked patients about their needs. In so doing, we made breakthroughs in understanding how the reproductive system functions and created opportunities for insurance and reimbursement, engaged in ecumenical counsel to enable religious viewpoints to be fully represented, changed adoption standards for young women who were survivors of a cancer diagnosis, and created new corridors of communication between oncologists, radiologists, urologists, gynecologists, endocrinologists, and a lot of other IS. By not standing on one principle, but testing and testing again until all ways of working, needs, and values were incorporated, we made progress. I am grateful to each member of the original consortium who represented fundamental and social science, the humanities and arts, and translation and clinical medicine. And I thank the patients, their parents, and partners for being part of the emergence of a new field of medicine that builds family capacity. Lastly, Marie Curie said, "The older one gets, the more one realizes that knowing how to enjoy the present moment is a precious gift, comparable to a state of grace." For my own state of grace, I thank my wonderful Woodruff and O'Halloran families, and especially my husband, collaborator, former first dude of Michigan State University, and extraordinary scientist, Tom O'Halloran. Tom and I collaborated on the discovery of the zinc spark, something so unexpected and remarkable, it sparked dialogue on the right and the left of the political spectrum. He enables all of this to be fun. And he and I love our next generation, represented by Kelly, Colin, Nathan, and Owen. We love each of you. Thank you to the Society for Women's Health Research for this recognition. This is a precious gift, comparable to a state of grace.